COVID-19 vaccines continue to be a critical tool in the fight against coronavirus. That includes rolling up your sleeve for the initial dose and maybe a booster shot if it's time for that. In today's To Your Wellbeing, we're breaking down the latest information about COVID-19 vaccines. Cone Health's Chief Pharmacist, Officer Dr. DeAnne Brooks joins us. Let's start with booster shots. I know a lot of people want to know about this. Who's eligible right now?
So if you are 65 years of age or older, you can get a booster vaccine. And if you are 18 years and older and you live in a long-term care facility or in any place that there are a lot of other people living there, like a college dormitory, you may get a booster dose of the Pfizer vaccine. If you have a chronic medical condition like a heart condition, high blood pressure, diabetes, and if you also work in a location that you are with a lot of people, so if you are a teacher or you work in a grocery store or a healthcare facility like I do, you are eligible to receive a booster dose of the Pfizer vaccine.
And you kept saying Pfizer. What about if you had Moderna or Johnson & Johnson?
Yeah, so we don't have authorization yet for Moderna and the Johnson & Johnson. Only Pfizer is authorized for a booster dose right now.
Any idea on the timeline on when we might get that for the other two?
So it's possible by mid to end of this month. The CDC is meeting on both the 14th and the 15th to look at the safety data for the Moderna vaccine and the Johnson & Johnson for boosters for them.
We've had people ask, well, I got Moderna. What's the harm if I just got the Pfizer booster?
Well, we don't know for sure because we haven't done studies on that, so we prefer for that not to occur. If it did happen by accident, I wouldn't see that there would be a major problem with it, but we would really prefer for that not to happen until we get the authorization.
Why is the booster shot needed anyway? Isn't it supposed to protect us?
Yeah, so the booster shot is needed because actually the effects of the immunity tends to wane over time, and that's what we have seen in the studies. And in addition to that, the Delta variant is a lot more contagious, and the Delta variant was not actually around whenever we studied these vaccines originally, and we have seen that the booster has helped to boost the immunity and reduce the serious infection that could potentially occur with COVID-19, particularly with the Delta variant.
A lot of people chomping at the bit to get one. What's the process? Do you have to register ahead of time? Do you just show up?
Yeah, so we do prefer registrations, and you can sign up for an appointment with Cone Health at conehealth.com/vaccine. And in addition to where you can get it from locations that Cone Health is sponsoring, you'll also see links to where you can get it from our community members or sign up for it for community members as well. It is available right now in more physician office practices and more pharmacies, a lot different from when we were initially giving the vaccines when we started back in December and January. So there are a lot more places to get it. In addition, we will be opening up the Greensboro Coliseum on October 16th with the health department, and we'll be giving booster vaccines there as well. We'll be there on the 16th and the 30th of October, and we'll also be there on November 13th as well.
How many booster shots have you guys given so far?
Oh, so far we have given almost 2,000 boosters.
So lots of people coming out for these then.
Yes.
Are they having the same side effects as the last time around? Is it different?
Yeah, so it's very, very interesting. So it's the same type of side effects. It's just very different individually, just as it was for dose number 1 and dose number 2. Some folks have no side effects or symptoms at all. Some people have reported that they have had more of those side effects, and those side effects are typically kind of like you feel when you get the flu. So you might have a headache, you might have a fever, might have chills, and it's just very individually dependent.
And the side effects do not mean that there's anything wrong. That's what we should expect, right?
Yes, it's your immune system that's working. And
What
it
about
doesn't matter if you don't have the side effects that your immune system is not working. It's just we are all individual beings who respond to it differently.
what about kids under 12? Any update on when they might be able to get the shot?
So we look for a meeting with the CDC on October 26th, and that is when Pfizer will present their data for the 5 to 11-year-olds. And once that meeting occurs, if authorization is given by the FDA, then the CDC will meet. I think I might have said that the CDC was meeting on the 26th. It's the FDA that's meeting on October 26th. And if that authorization is given, then there will be an additional meeting from the CDC, and they would give their authorization as well. And then there's one final step, and that is for all of the providers in North Carolina to get the okay from our North Carolina Department of Health and Human Services. And that usually happens in less than 24 hours after the CDC gives their authorization.
So they were looking at different doses for kids. Does that mean that it has the same level of effectiveness, not as effective?
Yeah, so it's the same level of effectiveness for the children. It's just it doesn't require as much of the medication. And we also look for there to be a different formulation for the children, for the ones who are 5 to 11 years old. So we won't be using the 12 and older formulation for the 5 to 11-year-olds. It will be a new formulation that we will receive.
Does that mean once it's approved, you'll have to wait for those shots to come in too?
Yes, so once it's authorized, we won't be able to just automatically use any of the supply that's on in our freezers or refrigerators. We'll have to wait until we get the supply from the state.
And are those lined up ready to go as soon as it gets the green light?
I don't know that for a fact, but I strongly suspect that it is, just like it was for the adult formulations as well.
Well, there's still a lot more questions about the vaccine out there, including should you get it and your flu shot at the same time? We're going to address those and much more right after this break. Send your questions in too. Just text 336-379-5775. We'll be right back.